Hello, my name is April. I'm a nursing student. I'm coming in to do a head-to-toe assessment. Can you confirm your name and date of birth?
Name's going to be Brandon Hyman. Date of birth is 11/15/97.
Awesome. So, the head-to-toe assessment, I am going to have to touch you and assess you from head to toe. Do you have any questions?
No.
All right. I'm just going to grab some hand sanitizer and then we'll kind of get started. All right. I'm just going to close the curtain so we can give you some privacy.
Okay.
Alrighty. So we're going to start off with vital signs first. I'm going to go ahead and get a temperature. It's going to go on your forehead and maybe a little cold. Looks like it's 97 degrees Fahrenheit. Alright, and then I'm going to go ahead and get your pulse. Thank you. And then just give me 1 second. Respirations look like it is 12. I'm just going to go ahead and continue to check your pulse. Sorry. I'm sorry if my fingers are a little cold. Alright, so looks like your pulse is 66. It is a little on the lower side. Alright. Alright, and then I'm going to go ahead and get a blood pressure. I'm just going to kind of slide this table in between if that's okay. And I'm going to rest your arm up here. Alright, so 122/78, so that's normal, so that's good. Thank you. Alright, and then part of vitals is I do have to ask you if you are experiencing any sort of pain at all. No pain at all? Well, you're lucky and blessed. Alright, let's see. And if you don't mind, we're going to go ahead and get a weight. We're going to go ahead and stand over at the scale over here. Alright, and then, yep, right there's fine. And it looks like you weigh 195. Perfect. Alright, you can go down to the seat again. 195. All right. And I know you were already told me your name and date of birth, so that's good. Now I do have to ask you, can you tell me where we are today?
My apartment.
All right. And can you tell me what is the next holiday?
Valentine's Day.
And what holiday just passed?
New Year's.
Perfect. Great. Perfect. Alright. Now I did see in your chart that you vape. We're going to go ahead and check your oxygen. So this is a pulse ox. If you can go ahead and put your finger into it. Thank you. Looks like it is 97%, so that's good. All right. So you are alert and oriented ×4. Your speech is clear. And we're going to go ahead and assess your eyes. This is people's usually like their least favorite part of this assessment. So I may have to blind you for a little bit. Alright, so I'm going to start off with this eye. It's just going to shine in your eyes. Right, and this side. Perfect. Alright. And then if you could follow my finger. Perfect. Alright, so your pupils are equal, round, and reactive to light, so that's a good sign. And your sclera was white, the conjunctiva inside your eye was pink, and your eyes are moist and not dry, so that's good. Alright. And your skin color seems to be consistent with your ethnicity. I don't see any rashes or lesions on your face. I do have to ask, do you have like any itching feeling at all?
No.
Okay, so that's good. Perfect. So the next part of this assessment is I do have to assess the inside of your mouth to make sure that there's no lesions, make sure your mouth is moist, pink. Alright, and then if you can go ahead and just say ah. Great, pink, there's no lesions, and it is moist. And your teeth are all intact, there's no missing teeth, you have no dentures, no gum recession or bleeding. That's good. And it doesn't appear that you have any trouble breathing, or, you know, I mean, I know you haven't drank anything, but do you have any difficulty like swallowing anything?
No.
No? Okay. So that's good. And do you wear contacts?
No.
Perfect. Alright. And I do have to check, this room's a little dark, so I'm going to use the pen light. If you could just kind of like lift your head up a little bit. And no jugular distension, so that's good. Alright. And there's no tubing or equipment or dressing, so that's all good. Alright. And if I can just, I'm gonna have to, it's gonna look like I'm pinching you, but I have to check your skin trigger. Alright, so you have the fast rebound skin triggers, that's good. Alright. Let's see. And it doesn't seem like you have any trouble breathing. Seems like you're pretty relaxed. So that's good. Your chest shape is equal bilaterally. You know, just if your stomach is round. Let's see. Alright. Now I did check your blood pressure and pulse, but I do have to make sure that your heart rate is equal. There's no pulse deficits, which would be cause for concern. So I'm just gonna go ahead and listen to your apical pulse, which is actually gonna be on your chest. That's gonna be for 1 full minute.
Okay.
And it might be easier, I'm gonna have you lay down. So you could, well, I guess I'll have you lay down this way. That's okay. Just lay down flat for me. Thank you. All right. And I just have a feel for where it's at. Okay. It's 65, but that's, it might have been just me missing one sound. But so your pulses are equal to your radial pulse, and no irregular heart rhythm. It's normal. Great. And then I'm gonna have to listen to your breathing sounds. So I'll start with the front. And if you could kind of sit up a little bit. Thank you, sorry. All right, and breathe in. Breathe. I'm gonna have you lay down if you don't in. Breathe in. And breathe in. Alright, no sounds of wheezing or crackles, so that's good. It's right in rhythm. They're equal. And I haven't heard you cough, so that's good. No shortness of breath. Great. Let's see. Alright, I'm gonna have you lay back down. I'm gonna just assess your stomach. And is it okay if I lift your shoulder blade a little bit? Okay. Great. Your stomach is round. It's warm and dry. It's good. Alright. Alright. Listen to your stomach now. This may be a little cold, so I'm gonna lift this up just a little bit. Sorry. Great. And does anything hurt? Do you feel any pain? Any tenderness? Okay. Thank you. And as of lately, have you been feeling nauseous,
Yeah.
any vomiting, indigestion,
All good?
any discomfort?
Yeah.
Alright. Now, when did you last eat?
30 minutes ago.
Okay. And would you say what percent of what percent did you eat out of
100%.
100%? Good. All right. Part of the assessment is I do have to ask you, when was your last bowel movement?
This morning.
All right. And let's see. And would you say your bowel movement was solid? Was it more runny? Was it
Completely normal?
solid?
Yeah.
All right. Any discoloration? Brown? Okay. And do you have any trouble going to the bathroom as far as bowel movement?
Yeah.
Okay. No constipation.
Yeah.
Right. And on with the bowel movement. So, next question is, have you been able to urinate when you feel the urge to go?
Yes.
All right. And when you do go, do you feel any burning or pain? Awesome. And do you feel like you have to avoid more frequently than you should?
Yeah.
That's good. Alright, and while I have you laying down, I'm going to go ahead and check both your pulses now, just to make sure they're equal. If I can just see this. Right. Yep, perfect. Alright. That is good. So they're both equal and strong. I'm just gonna go ahead and assess your hands again, but I'm gonna check for any edema, like any, your hands are holding water. No. All right, and then I'm just gonna press down your fingernails. Just capillary refill. Perfect. They're pretty rapid, under 3 seconds. Let's check this side. Yep. Rapid under 3 seconds. That's good. Okay. And let's see. And your hands were warm and dry, so that's good. All right. I know you're probably comfortable right now. Don't hate me. I'm gonna have you stand up. I'm gonna just assess your range of motion. So if you could just stand up and just do this. How's like you're swimming? This side. Perfect. All right. And then do you feel any stiffness? Is it easy to move?
Yeah.
All right. And then just go like this. Perfect. All right. Great. Okay. So that's active range of motion. While I have you standing up, if you can bend your knee and put it down. Bend your knee and put it down. Perfect. And good. All right. And you can have a seat now if you want. All right. So you have active range of motion. And I saw you walk earlier when I checked your weight. You did have a steady gait. So you move around independently. Let's see. So full active range of motion bilaterally to your lower extremities and upper extremities. So that's all good. Great. Okay. Perfect. All right. And I know you have socks on, but I do have to ask you to take them off. Let's check your feet. Alright, so I do have to check for capillary refill for your feet. So press down. Yep, perfect. Rapid refill. Let's check another toe on the side. Rapid refill. Another toe. Rapid refill. Perfect. Okay. And I'm gonna have you I'm gonna put my hands on top of your feet and you can just kind of push up, kind of like a little bit. Perfect. Alright. And have you push down like a gas pedal. Perfect, thank you. Alright, so they are warm and dry. Sounds good. Let's see. So equal strength for your plantar and dorsal flexion. You did that perfectly fine, no assistance. And you don't use any assistive devices to get around, you just walk independently. Perfect. Okay, yeah, I think that completes our assessment. I do have to know, do you have any questions? Do you have any questions to ask me?
No, you did great.
No? Okay, perfect. Well, I'm going to hand you the call bell just in case you need it. If you need anything, just let us know. Just call, if you need anything at all. Okay?
You got it.
All right, well, we'll be in a check on you momentarily.